department, be compassionate to patients who are and families who are frequently in crisis, all in the face of psychosis, disruptive behavior, assaultiveness and aggression, which is getting higher and higher in emergency departments, and families who are in crisis. That's a large role to fill. And so, but those clinicians who are seeing patients will drive that, which makes more of an argument for a psychiatric emergency department, a place away from med-surg patients where you can treat patients, trauma-informed care, appropriate forensic furniture, people who are trained to deal with psychiatric patients, maybe not an ED nurse, but maybe in fact a psychiatric nurse who has experience with behavioral health patients running the ED and setting the stage from hello, welcome to my emergency department, all the way through welcoming to a psychiatric unit with a warm handoff. Because if we don't treat patients well in the ED and we make decisions to send them to any other of our continuums of care, we're setting up a clinical fail and them not to receive the best treatment if we're not doing it well in the ED.
So talk to me about...
I guess sorry.
Oh, no, keep going.
I guess I'd say one more thing about that is we know that behavioral health patients need to come back in for tune-ups. And so with the vast majority of behavioral health services that are coming online, hospitals need behavioral health patients to say, I want to go back to that hospital. They really treated me well. Because the truth is you're not just going back for the behavioral health services. You're going back for your broken ankle. You're going back for your cough. You're going back for your flu. Those are repeat patients that we want to see coming back to us. So if we don't do it well in the ED about a behavioral health patient, we're losing all that business for that family for anything else they want to do, because that's frequently when families are in the most crisis. So how do we set them up for success, one, to get the treatment they need, but how do we set up for repeat business with those families by treating them well when they, in fact, are in probably the most crisis?
Going back to the various types of behavioral health patients that can present in the ED. So say that I'm presenting, I'm a student and I'm just stressed out, no prior behavioral health issues. I come into the ED and does a physician see me at MD first?
That's normally what happens, yes.
Okay, and then at what level, like, is it state by state that a behavioral health professional would see that patient prior to the MD discharging? Or
it's really not state regs that drive that. It's really physicians who drive that. So a physician will, in the vast majority of spaces I've ever seen, a physician will have to put in an order for what effectively is a consult, so a behavioral health consult. And so a physician will usually drive that through an order. So because you'll have someone who shows up and they're having stomach pain, but in fact, after a conversation, you find out that that's an anxiety symptom related to what the student has going on in their life. So if a physician decides that he or she can handle that on the spot and, has a conversation and moves it along, you may never get a behavioral health consult for what could be, right? Because one, that serves the patient. Two, that's a billable event in the ED. And three, it gets the patient further services than just the initial ED conversation with a physician.
Right. And I'm thinking about, like, in many of these cases that are more minor, right, like the nonviolent behavioral health patient. When you're coming in the ED, I can only imagine that would increase your stress, right?
Sure.
It's chaotic. It's pretty cold environment.
Sure. Mm-hmm.
What can you do to reduce some of that anxiety? Like, what could the space be? What could that environment be that would help reduce that stress?
Again, I think having a separate behavioral health space is one thing to do. But when you think about behavioral,
what would that
I think
look
trauma-informed, an ED pretty much, it frequently looks very sterile. And there's all kinds of reasons for that. That makes sense. However, when you have a separate behavioral health space, we have trauma-informed colors, right? It's not the whitewashed walls that we see